Now with that disturbing medical headline about breast implants and cancer, part of a widely shared story in the New York Times, raising concerns for the nearly 400,000 women who get implants in the U.S. every year. Now one woman is sharing her story. When Stacey Boone was diagnosed with cancer in 2015, she never suspected it was due to her breast implants.
I thought I had the flu. I was having hot flashes, severe sweating. Under my armpit, there were not only one, but 4 nodules in my lymph node.
She was diagnosed with breast implant-associated anaplastic large cell lymphoma, or ALCL, a rare and potentially deadly form of cancer that affects cells in the immune system found around the breast implant.
I had my implants done in the early 90s, and I was never told that I needed to go back and have them checked every so many years.
And she's not alone. The FDA saying over the last 6 years, there have been 359 reports of possible breast implant-associated cancer, including 9 deaths. The American Society of Plastic Surgeons telling ABC News it has a singular focus on patient safety and that it will continue to fund multiple research projects to further delineate this disease process.
There may be something about the texture of the implant inducing some inflammation causing the cancer, but it's currently not well understood why it happens.
After 4 6-week rounds of chemotherapy and a stem cell transplant at Moffitt Cancer Center in Tampa, Florida, Stacey's cancer is now in remission. Next month, she will be 2 years cancer-free. We're glad to hear that, and our senior medical contributor, Dr. Jennifer Ashton, is here. So tell us more about this particular cancer.
So this is really a new kid on the block, Robin, and a lot of doctors even haven't heard about it. You can consider it implant-associated lymphoma. It's a rare cancer, generally treatable. The symptoms basically redness, pain, some swelling or asymmetry in one breast. And take a look at these numbers because they're very important. In this country, in the last 6 years, there have been approximately 2 million implants placed for cosmetic or reconstructive reasons. So far, the FDA has tracked just over 350 cases of this lymphoma. 9 deaths so far. The estimates are that a woman's chance of getting this is about 1 in 30,000. It's a low risk, but it's not zero.
So what should you ask if you're thinking about getting an implant?
I think the more questions, the better. When you're getting something placed in your body, you want to know as much as possible about that. So when you're talking about implants, you want to ask what type of incision is being used? What size are those implants? And that will be in a unit called CCs. What is it filled with, saline or silicone? And who makes it? Now, this type of cancer has been more associated with this type of textured or gummy bear implant versus the smooth kind. You also want to ask, will it be under the muscle? Most are. And if you're getting silicone, will you need some kind of imaging follow-up like MRIs? Most women do not know all this information, and it is very important.
Anything else you can say to reassure women?
Yeah, we have a saying in medicine, an increased risk of a rare event is still a rare event, but awareness is very important here. Earlier treatment does matter. And again, with any procedure, risk versus benefit versus alternatives.
Got to keep that equation in mind. All right, Jen, thanks so much.